I'm very excited to introduce our presenter this afternoon. Leslie Lake is the co-founder and managing director of Invis Financial Advisors, LLC, an investment boutique based in New York City. Leslie co-founded the firm in 2006 with a specialty in long-short equity strategies. Leslie's been managing assets within the hedge fund industry since 1995. Leslie holds a Bachelor of Science in Economics from Simmons College, where she's also a trustee member of the Finance and Investment Committees and Vice Chair of the Board of Trustees. Very interesting to the topic, in 2018, Leslie suffered a bilateral pulmonary embolism. Her quest to learn more about venous thromboembolisms led her to the National Blood Clot Alliance. Despite living in New York City, Leslie was shocked by the lack of information available to her about her PE. Leslie volunteers her time to lead this organization and is committed to raising public awareness so no person affected by blood clots is without the necessary information they need to prevent or successfully treat venous blood clots, and that they have the information they need to navigate the spectrum of lifestyle issues that can follow a blood clot diagnosis. We're very happy to present you Leslie today, and Leslie, thank you for speaking about this very important information.
Thank you. Thank you. So I don't think I'm going to be using this microphone because I'm mic'd up. So first of all, thank you for having me. I'm looking forward to coming back next year and having the entire room filled with people as we move forward this year to really raise blood clot awareness, not just in Florida, but across the country. And I wanted to say thank you for WTW for sponsoring this, and also to the Florida Senior Living Institution for having me here today. So I have a presentation, and we're gonna start clicking so you can see this. So you see all these people on the screen. What do you think they all have in common? You've got professional athletes, you've got an influencer, it's bipartisan, we've got Hillary Clinton, some people say boo, some people say yay, we've got Joe Biden. We really have just a whole mix of people, men, women, young, older, black, white. I'm sure you can guess. They've all had venous blood clots. And now we can add Deion Sanders to that list because he also is going through this, as we all know. So before we get started on my presentation, I wanted to just tell you a little bit about myself and how I ended up getting involved with the National Blood Clot Alliance. I always like to have a presentation of a patient, and particularly in a healthcare community. And so I'm going to be the patient today so you can hear about what happened to me. So I had a blood clot in June of 2018, which is about 5 years ago. Prior to that, I didn't know what a blood clot was. Nobody had ever had a conversation with me about a blood clot. I would never have been able to tell you anything about a blood clot. And ironically, the morning that it happened, I was actually getting ready to give a speech in the hedge fund industry to women to tell them to take more risk. You got to take more risk. And when I was coming back from the dry cleaners, I couldn't breathe. It was literally like somebody just choked me and there was absolutely no air available to me. And it was really terrifying. Long story short, I ended up in the emergency room, and I'm in New York City, and this is, I think, relevant. And it was 2018, so not that long ago. And for 9 hours, nobody tested me for a blood clot, even though I presented with some of the same kind of household, if you will, signs and symptoms related to a blood clot. They were actually going to let me go home. And finally, the emergency room doctor who was on call said, you know what, we're going to do a scan of your lungs just to be on the safe side. And thank God, because I probably wouldn't be standing here today talking to all of you if they hadn't done that. The results came back, and the mood in the room changed dramatically, and I found myself being whisked away to the intensive care unit. That was the beginning of my blood clot journey. And so I left the hospital after several days being in the ICU with absolutely no information about what had happened to me other than, you've had a blood clot. Conversation with the doctor was, have you been on birth control? No. Have you been on a long flight? No. Okay, take this pill and don't ride a bike in New York City because you're on something called a blood thinner. That was the beginning of my blood clot journey. And so I found my way to the National Blood Clot Alliance, who really gave me all the tools that I needed to really get my life back. And I'm forever grateful to them. And as I started to immerse myself in this space, I realized this is the greatest public health crisis that nobody's heard of. And so we have a lot of work to do to make this a public health crisis that everybody has heard of, so that it no longer is a public health crisis. And with that, we'll get started. Okay, so blood clots, they can happen to anyone at any age. Blood clot is normal. For those of you who are actually in the healthcare space, you know this, right? It's a normal, complex process. It prevents excessive bleeding when a vessel is injured. However, sometimes clots can form abnormally. And clots that occur in arteries, you're probably aware of this, are referred to as arterial. Everybody knows arterial. And they cause strokes and heart attacks. But blood clots that occur in veins are referred to as venous blood clots. And they cause what are called DVTs and PEs, which we're going to get into. Next year, I'm going to have the slides there, so I don't have to go this way and back. All right, so let's talk about awareness, because awareness and prevention is hopefully what keeps us out of trouble here. So what is a blood clot? That's the first thing that we all need to understand. So it's a clump of blood, and it has changed from a liquid to a gel-like or a semi-solid state. And you can see here, we've got some pictures of what a deep vein thrombosis looks like in the leg, and also, I believe, what the deep vein thrombosis looks like. We might have an arm in here also, but you can see what happens basically as it goes from a normalized to an abnormal space. And the very last piece is the clot, which literally gets stuck. And we're going to talk about this because it causes injury at times, which can cause a reoccurrence issue. Okay, so venous blood clots. We've got two types here: deep vein thrombosis, which is called a DVT, and then we have pulmonary embolism, which is referred to as PE. The two of those combined are called venous thromboembolism. DVT typically happens in your leg. Deep veins of the leg can also happen in your arm. Sometimes it'll happen in other locations, but typically in the leg. The pulmonary embolism is the piece of that blood clot that breaks off, travels through your blood system, and lodges itself into your lungs, and it's very, very dangerous. So, as I said, DVT, clot forms in the deep vein of the body. It's called a deep vein thrombosis. We refer to it as DVT for short. Occurs most commonly in the leg, although, as I said, it can occur almost anywhere in the body, such as the veins in the arm, abdomen, or even around the brain. And for pulmonary embolism, as I mentioned, this is very, very serious. It's potentially a life-threatening complication of DVT. The PE, it's broken off and it's gone into the lungs. And then a pulmonary embolism, as you can see here, it occurs, as I said, when it breaks off, travels through the bloodstream, lodges into your lungs. Those are venous thromboembolism. Okay. DVT plus PE are collectively known as VTE. One of the problems that the blood clot industry has is it has a lot of words that are used to describe the same thing. And so we're going to try to kind of make this an easier to understand situation. Okay, so blood clots, they're actually really, really common, but very few people have an understanding of them unless you've experienced it. Unfortunately, this also means that a lot of clinicians don't understand it. So 900,000 Americans each year will either get a DVT or a PE. There's no actual reporting system in the United States for this the way there is for cancer, various forms of cancer, or HIV/AIDS, or other diseases and disorders. So we don't know the true number. A lot of times it doesn't get recorded as the primary source. We actually think it's much higher, but the 900,000 number gives us a base with which to start. 100,000 deaths per year. That's amazing and really sad. And again, the numbers that we've heard are somewhere between 100,000 and 300,000 in this country, and it's actually on the increase, not on the decrease. One person dies of a blood clot every 6 minutes in this country. Every minute of this day, somebody gets diagnosed with a blood clot. I have 50 minutes to talk today. That's 8 people that will die of a blood clot while I'm talking. Highly preventable. More Americans die annually from PEs, that's the pulmonary embolism, than AIDS, breast cancer, car crashes combined. And the data looks now that we can include prostate cancer in that equation as well. So think about the magnitude of the amount of people that are impacted by this and the fact that very few people are aware of it. Less than 6% of the population knows what it is. Less than 6%. So we have a lot of work ahead of us, but I'm pretty sure we're going to get there because we need to keep people safe. Okay, early diagnosis is critical to prevent complications, as you know, including death. Impact. So typically when you have a blood clot, the standard course of treatment is actually an anti-clotting medication. But we know that you'll have a reoccurrence within, about 30% of the population will have a reoccurrence within 10 years of actually having a blood clot. So it's typically not a one and done situation. If you've had one, you're at a very high risk of getting another one. And part of that they think is because the vein may have been damaged as the clot went through, and you're just much more susceptible to actually getting a blood clot in the future. This was probably the scariest thing for me to deal with, was how did I protect myself from getting another one of these? Because I was really afraid of dying. Okay, DVT and PE, sources of long-term disability. You'll see here 15% of DVT patients, they're going to have long-term complications. And I think it's about 4% of PE patients develop shortness of breath. I think I'm actually going to come off the stage and come down front so I can click and look, so I don't end up with a kink in my neck. And you can hear me anyway, so I'm going to go over here. Okay. 1 in 5 VTE patients will experience mental health problems. This was me. Requiring an antidepressant or anti-anxiety medication within the first 5 years of diagnosis. Why? Because people just don't have the information they need to handle the situation. You know, I struggled with having another one. I didn't want to be part of that 30% that would have another blood clot within 10 years. And maybe I need to move away from that. They contribute an estimated $15 billion in medical costs each year in the United States. So if we had an actual dedicated awareness and education program here in the United States, the way that we do with stroke, BFAST, FAST, et cetera, and heart attack, we could really put a dent in these numbers. Okay, let's talk prevention. Important. So what can you do to prevent a clot? Lots of things. Stay active, keep your blood flowing, which is what I'm doing right now because I'm walking around. But you know, we're serious. Stay active, try not to sit for more than 2 hours, get up, move, get a standing desk. Maintain an ideal body weight. I suffer from this. So I'm what's referred to as a desk jockey. I work very long hours in my office. You can probably relate to this. I bought myself one of those desks that goes up and down so that I can get up and move around a little bit. Maintain an ideal body weight. That's hard. Oh, sorry. I can't see my slides though. Okay, so know your risk factors. And family medical history, make sure you discuss this with your doctor. This is really critically important because it can help save your life. And this bullet point, if you're hospitalized or you're planning for surgery, speak to your doctor. What will be done to help prevent blood clots, such as an anti-clotting medication, which we refer to as the blood thinner or compression stockings. If they don't have a plan for you and you're going into the hospital, don't have the surgery. Don't have your procedure until they can talk to you about what's going to be done. Because nearly half of this happens in a hospital setting, and it's preventable. Okay, so common risk factors. Immobility, we talked about this already. It's important. Hospitalization, prolonged sitting, surgery and trauma, major surgery, pelvis, abdomen, hip and knee. Hip and knee, 2 top surgeries to get a blood clot. We're seeing a lot more in the ankle space now as well. Bone fracture or cast. Catheter in a big vein, such as a PICC line, which I'm sure you're familiar with, or a central venous catheter port. And again, prolonged sitting, get up and move. Increased estrogen. I think we had talked about this earlier. Birth control, patches, rings, pregnancy for up to 12 weeks after giving birth, estrogen and progestin hormone therapy. And then medical conditions, cancer and its treatment, blood clots, the leading cause of death in cancer patients behind cancer itself, blood clots. The correlation is huge. Most people aren't aware of it. Heart failure, inflammation, lupus, rheumatoid arthritis, inflammatory bowel disease, anything that incorporates inflammation can impact your ability to get a blood clot. Nephrotic syndrome, diabetes, HIV. I always make the comment, blood clots are sometimes the bride's maid and not the bride, but the bridesmaid can kill you. So all of these things are very common risk factors that you need to be aware of. And then other risk factors. If you've had a blood clot before, if you have a family history of blood clots, obesity plays a really big role in clotting. Listen, I suffer from this, but I need to focus on this. Clotting disorder, thrombophilia, it's called. 5% of the American public has a blood disorder, has thrombophilia. Doesn't mean that you're going to get a blood clot, but you should discuss this with your doctor. Smoking, older age, which is a big deal here in Florida, and frankly across the country now, varicose veins, dehydration, and of course COVID-19. You had asked about COVID and blood clots, and what we saw initially at the beginning of COVID was an escalation in blood clots. As the vaccines came through, we saw a decline. Patients were going into the hospital and being anticoagulated. We saw a decline. But with the J&J vaccine, we did see, particularly for women of childbearing age, some issues with clotting. Okay, so here we have a risk chart. This is really super easy. I highly recommend that people have this in their institutions. Take it to your doctor's office, whoever is treating you, if you have a PA. This is a really important document. You can download it off of our website. Everything that's on our website is free, and there's a ton of material, so please feel free to jump on. And you can see we've got everything listed here: hospitalization, surgery, confinement to bed, obesity, birth control, family history. This is a really important risk chart for you to have. Know your risk. Stop the Clot, Spread the Word is a campaign that we actually did with the CDC. Actually reached over 200 million people in the United States. So, it's been a great campaign to raise awareness. This should be in every hospital, every senior center, anybody who has patients. And what we did here is we said, hey, you know what? Stroke has been really smart about fast and be fast. Let's do the same thing. Stop clot. These are some of the signs and symptoms that people can experience. Download it, put it up, hand it out. I have shirts that I wear it on. I have so many people come up to me at Home Depot and talk to me about signs and symptoms. But it's a wonderful thing. Johns Hopkins actually has it in their hospital now, and it's really starting to spread like wildfire. So this is an easy thing. It shows where the clots are or where they can go. Okay, so we refer to DVT and PE symptoms as the great mimicker. And why is that? You have a heart attack. Everybody knows somebody puts their hand over their chest. If you have a stroke, you know what the symptom of that. Someone's mouth may be droopy. It's a sign that maybe you're having a stroke. But the problem with blood clots is that there are many, many symptoms, and it can mimic many different things. And so what happens a lot of times is someone will go to the hospital, or they'll brush it off because they think they've pulled a muscle or what have you. This happens a lot in the emergency room where people are told, oh, you've got a respiratory infection, here's some antibiotics. You don't. You have a pulmonary embolism. And so that's why it's so important for us to know the signs and symptoms. Probably the most critical thing in terms of awareness is actually knowing these signs and symptoms. Okay. So symptoms, they range from mild to almost barely noticeable to really severe. So in my case, the day before I had my blood clotting event, I was out walking my dogs. And I noticed I was a little short of breath, and I thought, I need to go back into the gym and get my cardio back in gear. I probably already had the clots in my lungs, and it wasn't until the next day that it became, really severe to the point where I couldn't breathe. But again, I showed up with traditional signs and symptoms. And it took them 9 hours before they figured it out in the hospital. I could have died in that time frame. As I said, symptoms can be confused with other medical conditions, leading to either a wrong or a delayed diagnosis. You know your body better than anybody else. If it doesn't feel right, it isn't right. And if you keep having signs and symptoms, if you're still, go to a different hospital. We've had people who have done that best decision they made. Don't let somebody push you aside. Okay, deep vein thrombosis, remember, those are the clots that are typically either in the leg, can be in the arm. What are the symptoms? Pain. People will say it feels like the worst Charlie horse they've ever had in their life. Swelling, the leg or the arm becomes swollen, sometimes a little bit, sometimes a lot. Discoloration, it'll turn blue or purple or red, and the skin is typically very warm to the touch. So that's DVT. Pulmonary embolism, the PE, shortness of breath, that was me, top of the list. Chest pain, a lot of people complain about when they take a deep breath, it hurts. An unexplained cough. Well, how many of us have had an unexplained cough before? That's a symptom. Sometimes you cough up blood. In my case, I had a very rapid heart rate. So I had, 2 of the risks for PE. They just got it wrong. And again, misinterpreted as a respiratory infection or heart-related issue. One of the young ladies that I showed you on that initial page of the folks that have had blood clots is a gal by the name of Katie Hoff. And Katie was an Olympic swimmer, and she actually still holds many Olympic records. She was a young woman in her 20s, and she started to experience shortness of breath. She was having pain in her back. She had Olympic doctors that were treating her. And they completely missed it, and they missed it to the point where she finally collapsed one day. They finally figured out that she had a pulmonary embolism, but she had scar tissue in her lungs, and it ended her career. She's a wonderful, beautiful young woman, and she's actually working with us now to raise awareness. Okay, so who's at risk? Basically, everybody who's in this room is at risk, and everybody who's in this hotel is at risk, and everybody who's in the state of Florida is at risk, and everybody who's in this country is at risk. But they do not discriminate. They can affect anyone, regardless of your sex, your age, your ethnicity, or race. Everybody is fair game for blood clots. Leading cause of preventable death in hospitals in this country. 40% associated with hospitalization, occurring either in the hospital or after discharge, typically within 30 days after discharge. Preventable. 70% of DVT and PE patients, preventable through prevention measures, such as an anticoagulation or compression socks. Think about how easy that is, but it's not done. Fewer than half actually get it in a hospital setting. So why are hospitalized patients at such high risk for blood clots? Well, there's many different factors that make them higher risk for a blood clot risk. Again, we come back to prolonged immobility. People are in their beds, people are sitting around, they're not moving. They've had trauma or surgery. Again, hip, knee, abdomen, pelvis, etc. Medical condition, procedure, catheter, pregnancy. You see it here. Hospitalization, a major risk factor for developing a blood clot. You think when you go to the hospital you're safe. And you are for the most part. But you need to have a conversation, sort of begging people, have a conversation about what the blood clot prevention protocol will be prior to your surgery or whatever procedure it is that you're having. Not just in the hospital, but when you leave the hospital. Okay, women and blood clots. So women, while everybody is at risk of getting a blood clot, women actually have a higher chance of getting it. Between puberty and menopause, they've got a higher risk of VT. Hormonal birth control, pregnancy and childbirth, menopause, hormone replacement therapy. 20% of maternal death in the United States due to a blood clot. Preventable. Pregnant women have at least 5 times higher risk of a blood clot than an average person. And look at this. Risk. This is crazy. 100-fold in the first week after the baby is born. I can't tell you how many people contact us about this. They've had a blood clot after having had a baby. And in some instances, both the mother and the child have been lost because of it. Risk remains elevated for up to 12 weeks following delivery. It used to be that the rule of thumb was 6 weeks, but we've seen an escalation in terms of blood clots after postpartum. And so the CDC has actually moved it from 6 to 12 weeks because just of the high incidence level. Again, we've got all kinds of information on women and blood clots. Feel free to download this. Lots of great information. I don't know if this is on another chart or not, but I'm going to share this with you. So the 20% of maternal death in the United States caused by blood clots, it's actually one of the leading causes for Black women in this country. And we've all been learning and reading about Black maternal health in this country. This is preventable, but people need to be educated and made aware. Okay, more women in blood clots. Estrogen increases blood clot risk. We've already talked about this. Pregnancy, leading cause of death in women during a pregnancy or just after having had that baby. 9% of pregnancy-related deaths in the United States due to blood clots. And you can see here, outcomes are worse for Native Hawaiians, Blacks, American Indians, Alaskan Natives, than Caucasian. There's various reasons for this, some of which is structural racism in a hospital setting. Clot risk is increased during all trimesters, highest during the postpartum period, and again, remains elevated for up to 3 months after having a baby. In pregnancy, it's 5 times greater than in non-pregnancy. Women on birth control, 3 to 4 times. I'm sure there's a lot of people in here that have been on birth control, and did anybody sit down and have a conversation with you about the risk associated with birth control? And again, why? The increased risk associated with pregnancy. So the combination of things, lower blood flow in the body, particularly in the lower extremities. There's vessel damage. We had talked about this before. And then estrogen creates a hypercoagulable state that impacts people. So a couple different reasons that puts women at a higher risk of blood clot. And again, pregnancy increases clot risk that remains elevated for up to 3 months after having a baby. And again, you see it on birth control pills 3 to 4 times. If they're estrogen related, for hormone replacement therapy, 2 to 4 times. So if you have a blood clot and it's tied to estrogen, they may tell you, doctors may tell you, you'll be on an anticoagulant for 3 months, 6 months, depending upon what their protocol is. But you now have a risk factor. And next time you go to the doctor, or you go to have a procedure, or you go to have surgery, you need to tell your doctor, I had a blood clot. They think it's related to me being on hormonal birth control or hormonal replacement therapy, but you've had it, which means that your risk now goes up. Okay, cancer. We kind of talked about this earlier. So it's a common complication in cancer patients. And again, leading cause of death in people with cancer after cancer itself. Cancer is on the rise in this country. Most people aren't even aware that blood clots and cancer are correlated with each other. 4 to 7 times greater a cancer patient, the risk of getting a blood clot, than somebody who doesn't have cancer. And the risks vary by location of tumor, patients, additional risk factors, immobilization, here we go again, obesity, prevalence of thrombophilia. You've got to have that conversation with the doctor, because what we find with the cancer patients is they don't get the information about blood clots. So we're kind of changing the tables a little bit, turning the tables a little bit to educate the public to be made aware of this. Okay. And again, survival rates are much lower for people with cancer who have also had blood clots. And the risk of blood clot is greater in the first few months after cancer diagnosis. Sounds familiar. My father had esophageal cancer. He unfortunately passed away from it. He got a DVT. His symptom, the worst feeling Charlie horse he'd ever had in his calf before, and it was tied to the cancer treatment that he was receiving. Okay. Why is it? Because active cancer and some treatments actually increase clotting risk. The body's in an inflammatory state. Huge, huge risk of developing blood clots. Talk about it with your doctor. Bring that risk chart with you. Okay. We know there are racial differences in VTE, and we don't have very good data around this. So this is an area where we need to be spending more time. So there are a lot of studies out there that actually show that VTE occurs differently by race, with Blacks having the highest rates, followed by whites, Hispanics, and Asians. Some of this is structural racism. The overall incidence, 60% higher in Black individuals than whites. And their 30-day mortality compared with white patients is much higher as well. Preventable. Okay, older aged people. The older I get, I'm never sure what to call this chart. But today I called it older aged people. So big increase in VTE, particularly during hospitalization. They have a lot of comorbidities as well. Once you hit, it used to be once you reach the age of 65, the risk of VTE went up pretty dramatically. It's now the age of 60. So it's actually come down. Being over 65 is a risk factor. 17% of the population in the United States now is over 65 years of age. And in Florida, I think it's 22% actually. But it's going up because as the population is getting older, this is going to become a bigger and bigger problem. And again, a decrease in mobility, one of the main reasons, increase in sitting raises the risk of a VTE. So everybody needs to go back to that first chart and start moving. Well, I can help you with blood clots. The other thing I can't help you with. But the presence of other illnesses also increase the rate of VTE. We talked about that. So comorbidities actually play a big role in there as well. But even for those that don't have comorbidities, the rates go up pretty significantly. Okay, so what are the effects? Oh boy, blood clot survivors face many challenges. So they're on an anticoagulation or what's called a blood thinner. Foremost, bleeding. Bleeding is actually one of the top reasons why people go into the emergency room because they've had a fall, they're on a blood thinner. There's a concern that they've had a bleeding event. For people over the age of 65, this is a major, major concern. There's something called post-thrombotic syndrome, which happens after a DVT. And this causes pain and swelling of an extremity, and it doesn't go away. And it's one of the leading causes of disability, actually, in this country. Chronic lung damage called pulmonary hypertension after a PE. So you have continual shortness of breath for the rest of your life. And obviously, it's very costly from a medical care and hospitalization standpoint. And then what we've seen, high levels of anxiety, depression, stress have been reported. We actually did a survey on this called the CLUES survey because we were hearing from so many of our patients that this was an issue for them. And we put out a survey to see what the response rate would be. In 24 hours, we had 650 patients take the survey, which is enormous. We finally cut it off after about 3,300 patients. 97% of the people who took the survey who had had a blood clot, so they suffered from PTSD for years, and then it never actually went away. So they're not getting the information to handle the situation. Okay, and again, complications of DVT and PE, post-thrombotic syndrome, pulmonary hypertension, mental health, and quality of life. So some blood clot patients, they recover within a couple of weeks, and they don't have any significant complications or long-term adverse effects, and some people experience ongoing problems for the rest of their life. You know, in my case, my symptoms lasted for about 2 months before they finally went away, but the PTSD side of it lasted, you know, for a long time. And frankly, it's still with me to this day. If I travel, if I'm flying on a long flight and I feel a pain in my leg or I feel a little short of breath, I immediately think I'm getting another blood clot. So I certainly understand the mental health side. Okay, so let's talk about treatments. So primary treatment in this country is something known as an anticoagulant or a blood thinner. In 2012, something was introduced called direct oral anticoagulants called DOACs. And that's the Xareltos and the Eliquises of the world. You don't have to have your blood checked typically for this. And then we have Coumadin and Lovenox. The DOACs are a pill. Coumadin and Lovenox, some of them are actually done by injection. Compression stockings, really, really easy. Get compression stockings, particularly for older people. It's a great thing for them to have. Thrombolytic therapy is when doctors come in and they'll basically push drugs into your system to try to break up the blood clot. Vena cava filters, we're trying to get away from this. This is a little bit antiquated at this point, but we still use them, where it's a filter that gets put into your body to try to capture those blood clots that are coming up, trying to get to your lungs. And then something new is called mechanical thrombectomy, and that is a device. Think of a little wire that's put into your body, and it was originally used to take PEs out of high-risk patients in their lungs. It's now being used for medium risk. It's being used for DVT. They're starting to use it for stents, and I think this is a really fantastic way in which we're going. And then the other thing that's happening is for the anticoagulants, bleeding risk is obviously a really, really big concern. There are several trials ongoing now for what's called factor 11, which are going to be hopefully the new DOACs that come out that will have much less bleeding risk. So it's in trial now for AFib and for cancer, and so we're hopeful that the bleeding risk associated with the DOACs and other blood thinners will be a thing of the past in the not too distant future. Okay, so in conclusion, blood clots, they can happen to anyone, any age, any race, any sex, anybody can get one. They're often preventable. The majority of them can be prevented. That's why I'm here today, because I know they can be prevented. If we have more awareness efforts out here, we can save so many lives, but early diagnosis is critical to prevent complications, including death. And if you suspect a clot, do not delay getting medical help. Call 911, go to the hospital. If you have shortness of breath, call 911. If you suspect you might have a DVT, also important, but get yourself to the hospital and don't take no for an answer. You already heard about me. I'm old news. A little bit about the National Blood Clot Alliance. So we are a nonprofit. We are 20 years young at this point, and we were actually established by a group of patients and clinicians who saw the need for an organization like us to spread awareness. We are supported by an amazing medical and scientific advisory board. And the majority of people actually volunteer for this organization, including myself. So you can see a little bit of our mission here. Here's a QR scan. Please feel free to scan it. Go to our site. All kinds of great information. And again, everything is free. We don't charge anybody for anything, as it should be. And if you'd like to advocate or learn more, again, there are some ways to pitch in and help. And that's my thank you.